It's that time of year when the air fills with pollen and millions of hay fever sufferers reach for their tissues. According to a report by the Royal Pharmaceutical Society, many people are still not aware there are sufferers, often mistaking the symptoms of hay fever for a cold. Well, Dr. Anu Bahtia, who you will see... Oh, I thought you might have seen a clip, but never mind. Perhaps we're not running that. She's here nevertheless. Good to see you.
Hi.
How are you?
Fine, thank you.
Thanks very much, Steve, for being with us. 5 million people apparently can't tell the difference between hay fever and a cold. Are you surprised by that?
No, not at all. I think with the pollen season going a bit astray, tree pollen and grass pollen sort of overlapping, the seasons occurred much earlier with environmental change. So, for example, in February I was seeing patients who thought they had colds coming to the surgery and they actually had hay fever.
I think we've got the clip I was talking about. Yeah, let's have a look at it.
Your nose starts to run, your eyes are puffy and watery, and you're sneezing all the time. But is it a cold, or is it hay fever? This year, the hay fever season started early and is catching many people out. Colds and hay fever share many of the same symptoms, sneezing, a runny nose, but there are some distinct differences. A cold is usually accompanied with feeling generally unwell, a sore throat, headache, maybe a temperature, but typically it only lasts a few days. Whereas most hay fever is seasonal and caused by grass pollens, the symptoms are watery, itchy eyes and sneezing, and this can last up to several months. So thinking about your symptoms and getting the right treatment is not to be sniffed at. Feel the fever.
Excellent. Well, that's very good advice and a good background to the whole problem. You've got some remedies here, right, for hay fever. Let's just have a trot through them. Tell me what you've got and what works.
Well, I think, first of all, avoidance is the key. Yeah. So if you can avoid going out early in the morning or in the evening when the pollen count is highest, bit of Vaseline inside your nostrils, around your eyes, sunglasses, anything to stop pollen actually coming into contact. But, of course, that's not always ideal.
Sure. Or practical.
So best thing to do is to go to your local chemist and talk about your symptoms. You've got all antihistamine tablets. These sort of second-generation ones are not as sedating as the older ones, and they're once-a-day preparations. You've also got nasal sprays, which are very effective, sort of use them once a day. And nasal sprays really are very good in controlling the sort of itchy, watery, runny nose and the sneezing. Not so good for the eyes. The eyes, you get red, watery, itchy eyes, swollen, puffy eyes. So again, you can use some antihistamine topically in the form of eye drops.
So, you don't have to go to the doctor, do you? Let's stress.
You don't, no.
Not initially, anyway.
No, I think you can speak to your chemist and describe your symptoms. And, of course, if that doesn't work, or if your symptoms aren't responding to conventional treatment, there are ways and means that we as GPs can help you.
Yeah, and you've got to bear in mind that distinguishes, you made the point, hay fever generally lasts for quite a long time. Cold
well, it lasts for as long as the season is.
Exactly.
Whereas a cold usually goes after 5 to 7 days.
What about these so-called natural remedies we hear about?
There's not a lot of evidence to support them, but, I mean, things like vitamin C is supposed to be good in just sort of promoting your immune system, so reducing that response to the pollen. People have said nutrients such as rutin, also acupuncture, but again, you're not really going to find many GPs supporting that.